Low back pain can be a serious condition causing you to lose time at work and money from work, but maybe more importantly, keep you from doing the activities you love to do. So what's the most likely cause? I'm Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Low back pain is one of the most common reasons for doctor visits. It affects your ability to work. It affects your ability to live normally. If you have lower back pain, it's important to find out what the cause is so you can get proper treatment, but also prevent it from coming back. So in this video, we're going to discuss some of the common causes of low back pain and their symptoms. The most common cause of low back pain is a muscle strain. A muscle strain happens when you lift something heavy or you do some repetitive movement that puts strain on the muscles in your lower back. I've done this several times over the last 10 years or so, and it's miserable. It can be caused by a sudden movement, like maybe falling, slipping on the ice, maybe you fall on your tailbone, your coccyx. It can be accompanied, and a lot of times, by swelling, tenderness in that area. But sometimes it can aggravate an older injury or one that hasn't necessarily healed. The pain can come on all at once, especially if it's a traumatic accident, or can come on more gradually over time. Tends to be worse as you move around more during the day and gets better when you're resting, lying down, sitting still, that type of thing. For muscle strain, you can try anti-inflammatory medications, try a period of rest, try heat and ice. You might consider seeing a physical therapist. I'm a big fan of physical therapy. If you have a muscle strain or sprain of your lower back and it isn't getting better, big fan of physical therapy. And then you consider seeing your doctor if your symptoms last longer than a few weeks without getting better. Or if you have things like numbness, tingling, weakness, or pain radiating down one of your legs. Those may be a sign of a more serious problem like spinal stenosis or herniated disc. So let's talk about that. Herniated discs. These are common causes of low back pain. A disc is a cushion between each vertebra in your spine. It acts like a shock absorber for your spine. Now, discs are made up of cartilage and gel inside of it. Some people say it's sort of like a jelly donut, if you can imagine that. They can be damaged either by injury or wear and tear over time. Sometimes they bulge, sometimes they actually herniate, meaning the internal gel comes out and puts pressure on the nerves coming out of your lower back that run down your leg. These herniated discs can cause pain and numbness in your back, but also the legs, buttocks, groin region, depending on which nerve is involved, and weakness in one leg. Degenerative disc disease. This is basically the breakdown of discs in your spine. It's a common cause of low back pain, but there are a number of other factors that contribute to it as well. It can occur at any age, but it's typically as you get older, and it can also be affected by things like lifestyle choices and genetics. Treatment for degenerative disc disease really depends on how bad it is, but it could include things like physical therapy, anti-inflammatory medications, and injections into the spine. Spinal stenosis, one of the last ones we'll talk about, that's a condition that causes your spinal canal to narrow. Leads to compression of the nerves in your spine, which can cause severe pain in your lower back and legs. Most often it's caused by osteoarthritis or essentially wear and tear on the joints of the spine, common in people with a history of scoliosis or maybe spondylolisthesis, where one vertebra slips basically in front of the other. The symptoms vary from person to person and can include things like numbness or pain down one leg, pain that's worse when you stand, pain that's worse when you're walking, especially for a long period of time. It can be pain sitting down or even turning over at night. So those are some of the most common causes of low back pain. If you have low back pain, it's important to see a doctor, preferably a spine specialist, who can help you determine exactly what's causing your symptoms and treat those accordingly. I'd love to hear about your experience with your back injury. Leave those in the comments below. Just understand I can't offer you medical advice, but I will try to answer your question in a future video. Make sure to subscribe to my channel. Click the bell to be notified when I release a new video and when I start my next live stream, including my Ask Dr. Geier live shows. Thank you so much for watching. Really appreciate it. Look forward to helping you feel, look, and perform better than ever.